I'm Denise Tiran. I'm Expectancy's Chief Executive Officer and the Education Director. I'm a midwifery lecturer and I've specialised in complementary therapies within midwifery for most of my professional career. And I love teaching midwives about the different complementary therapies. I really do think it's important that this is something that should be included within midwifery practice. So many women are using complementary therapies now, and we need to know about it as midwives. I think it's important that we have good quality education, but also education that prepares midwives for working within the system that they're already working in. For example, the NHS, or whether they're going to be working in private practice. Complementary therapies are not just relaxation therapies. They're very powerful and they can be very, very effective in treating women's conditions during pregnancy, whether those are physiological discomforts or very specific complications of the pregnancy. It is important to know about who can have these therapies and whether there are any contraindications. And it's also important to be aware of the evidence base, the research that's been done on the different therapies, so that midwives can argue their case with the sceptics. Sometimes you come across other professionals who are not quite so receptive to complementary therapies, and part of what we have to do is to try and convince our colleagues and mums-to-be that we can use complementary therapies, but that we must do so safely. At Expectancy, we are very keen that midwives undertake good quality training. We like to think we are good quality courses, but it's more than that. It's actually about being able to set complementary therapies in the context of midwifery, in the context of the Nursing and Midwifery Council Code. Quite often, midwives are just learning a small element of a particular therapy, so they're not qualified in that therapy. They are actually applying that to the maternity care, the midwifery care that they are already providing. And we want midwives to be able to do that safely, and also so that they're protecting not only the woman and her baby, but their own professional qualification and registration.